Well, I just want to thanks again for letting me come in and speak, because it's very important. I don't know if you're aware of it or whatnot, but 1 out of 3 American adults are pre-diabetic individuals, and only about 10% of them are aware that they are at high risk for developing type 2 diabetes. So it's really not very good news, but the good news is there's programs like the YMCA's Diabetes Prevention Program that will help increase the awareness of diabetes and how to prevent it and promote a healthier lifestyle. The National Institute for Health had done a clinical study with individuals with pre-diabetes, and it was very strong in reducing the developing type 2 diabetes through putting them through participating in an intensive lifestyle intervention program. So the evidence was so strong that YMCA actually took the program, translated it into more of a doable program, but kept the fidelity of the clinical trial that the National Institute of Health had performed. So our program is based on that program, but we kept the fidelity of it, but we're also allowing it to reach thousands, millions of people throughout the country, because we have a YMCA pretty much in within 5 or 10 miles of most people in the country. So so we hope to get those numbers down of people going down the path of a unhealthy lifestyle and developing type 2 and all the complications related to it. So the program at the YMCA, it's a 12-month program, and it's 16 weeks. You meet with a trained lifestyle coach that's certified through the YMCA. And you meet once a week for an hour in a small group setting from 8 to 12 individuals. So we like to keep it small, cozy, and it's all, all private and such like that. And it's very, you work with a lifestyle coach once a week for 16 weeks. And then you actually get together once a month just for maintenance and keep people on track. So the nice thing about it, it's a lengthy program and it's intensive. You also have the exercise component to it. So you're taught the lifestyle changes of healthy eating, tipping the calorie balance. In here, there's a whole program, probably syllabus if you want to call it that, on what we cover in the 16 weeks, the subject that we cover for the 16 weeks class. Just to give you some ideas, is be a fat detective, learn how to begin keeping an accurate food journal, ways to eat less fat, healthy eating, move those muscles, being active, tip the calorie balance, and so on. Problem solving. So there's a lot of skills that we go over on keeping people on a healthier lifestyle. The program goals are to get your body weight reduced by 7%. And to gradually increase your activity level up to 150 minutes per week. So that's really only about 30 minutes of moderate exercise, 5 days a week. It's a very doable program, very, very doable. And with those numbers, with just losing 7% of your body weight and 150 minutes of moderate exercise, kind of like brisk walking, something equivalent to that, the evidence has shown that from this programs like the YMCA's diabetes program as well, you'll find the reduction of your risk of developing type 2 diabetes is about 58%, okay? So 58% less at risk. And then if you're age 60 or over, you reduce your risk of developing type 2 diabetes up to 71%. So it's significant. And they're just very small lifestyle changes that we help you in your life. So it's not a short little program, it's a whole year, so that way you have time to make them actually stick with you like a lifestyle change should, so that, and we keep them involved with exercise programs. It's nice to be at the Y because you have the expertise of personal trainers, classes there, it keeps them interested. They might be more apt to get more exercise if they know that in a small group they make friends, and they just end up doing things like that. Because I know at the Y, just in the classes I teach, the people that come in, they just make such great long-term friendships, and they go out for coffee afterwards or whatever. It's just all the Ys have that nice family, nice warm feeling, and people stick to the program. So we are starting programs at the end of April. It's going to start up in Fall River, Wareham, and New Bedford, where I am. And we're just going to do 8 to 12 people is what we want to start a class. And if anybody has any questions, wants to learn about the program, take a tour, I'd be glad to have them contact me at Midwood at YMCASouthCoast.org, or just give a call. I'd be happy to take them on a tour and give them some more information on the program. So we hope by promoting healthier lifestyle and just making aware that how prevalent pre-diabetes, not being aware that you have it. We have a quiz here too, and the brochure has it in there as well. Is just to show you if you're at risk. There's a quick questionnaire. It's like 6 questions, very easy. Like, are you a woman who has given birth to a baby weighing more than 9 pounds? If you answer yes, you get a point. And certain things: are you younger than 65? Are you between 45 and 64? Different easy questions. If you score 9 or above, then you are at high risk. You could be at high risk for developing type 2 diabetes, and that would actually qualify you for the program. Although it'd be best to actually, if you have your blood glucose level from your physician or your A1C number, we would just need that, and you could get going with the program. There is a fee for the program. You do get a one full year membership with the Y with that program, with the program, and it is less than it's a lot less, like $100 and some odd less than an adult single membership at the Y. There is financial aid available too for the program, which is nice. The program is $429 for the year. That can be broken up in 4 payments, so we space it out. But what's nice about it, if you broke it down, it's only $1.18 a day. You know, everybody uses that cup of coffee analogy. I won't do that, but I just did, didn't I? But you know, you can always find $1.18 in your pocket, and that's without even financial aid or anything like that. But for insurance, some insurances might help with the cost, defray the cost as a benefit. We're working with several insurance companies now. I know in Rhode Island, United Healthcare, I believe, actually offers it as a wellness program as a benefit to their clients. You have
Tufts has $150 a year towards the Y membership, and our employees under their Blue Cross and Blue Shield do not get it.
Do not, but Tufts does. That's primarily.
So most small, that's your Blue Cross, I guess, because you're not. Blue Cross automatically does it for their standard.
It's through the union, so it's a different policy.
Yeah, they do have the fitness for actually all the health plans. And Fallon does up to like 4. They do a higher amount. They do like 200 single, 400 family, and so yeah, it's more generous.
Nice.
So everybody does something. Whether it qualifies, I mean, obviously the Y membership qualifies is the fitness part of it. There's probably something that you would have to do as a Y to outreach the health plans to see if it would fall under the, like they do also the Weight Watchers.
Yeah.
So, or qualified dietitian, you know, so this might, you'd have to get approval to get that into a qualified weight reduction program.
Yeah, well, you also do get you do sign a membership form, so you want, it is
so
a
definitely
membership.
would go under the fitness.
Yeah, I do believe it would probably fine, but it's definitely, we have a number to call and all that, so it's wonderful, considering the cost that insurance companies spill out. I think on an annual basis, for an individual, an insurance company, someone with diabetes, it's around, I've seen 2 numbers, $14,000 a year up to $20,000 a year to pay for someone that is diabetic. Over twice as much as someone without it. Yeah.
As far as like access to employees, what time do you think that these classes are going to be offered?
We're offering them at 6 o'clock right now, and we're going to take 6 p.m. at night. Yeah, Fall River on. Wareham's on a Tuesday evening at 6, starting the 28th of April. And Wednesday in New Bedford at 6, and then Thursday, I believe, in Fall River. I can double check that, but
great.
That's what it is. 6. It's only 1 hour.
And Dara, you go into the work sites if possible, no? Yes?
I would love to. Yeah, we don't have to, you don't have to go to the Y. Right now, we're offering at the Y, but we would definitely, if you have 8 employees or more, we'd be happy to take it to your site. And whatever's convenient for you during the day, during a lunch hour, during a shift change, whatever. And so we have coaches trained in Fall River, New Bedford, and Wareham ready to go. So I'd love to go to on-site. That would be great. Yeah. Is there anything else I
So
forgot?
once again, just to clarify, do you need to have the medical indication?
It's not
Or-
necessary.
okay.
It's nice because it is, we do track everything. It's on a data
Yeah.
collection called BASE, and we do report it to the CDC, and they need that data. So if we at least have 50% of participants with that glucose level,
I think
would
to
be
get
great.
the A1C would be better, because then maybe you would qualify for the insurance reimbursement more,
Mhm.
you know, more to push it
Yeah.
or not. I don't know if they would reimburse it, but otherwise you're just filling out a quiz, right?
Right. Oh, I would, if you can get that, most people do have like your annual physical, you at least get your blood glucose on there. It's just the A1C, unfortunately, they don't test for that. And it's not always a fasting glucose level either, so, but that would be good. I mean, I checked mine, you made me check mine, my glucose level. I was like, I'm up on camera, I guess maybe I shouldn't say it.
Yeah.
But I was like, wow, but it has to be fasted probably to be more accurate.
Be more accurate,
Yeah.
yes.
So.
About 2 hours after eating would be,
Mhm.
better.
Yeah, yeah, the A1C would be awesome, but some people might not have that. I'm trying to get the wellness van to come to 3 locations in May to do a screening at Fall River, New Bedford, and Wareham, so we're going to put that out too, so if people want to get screened to see, find out more about that, I can let you know.
Is this, do you have a grant from the CDC to offer this program, or is there any, this is all?
This is
on
it
you
right
guys?
now,
You-
yeah.
You don't have any funding or anything from them?
Not right now, no, they're working on that, but, we have our financial aid, that we're depending on the individual, we could give like 30 to up to 50% off the cost, so. And hopefully it's gotta be paid off in like within 90 days, so it's $129 up front, 100, 30 days thereafter, 100 after, so we break it up. But it is a commitment, you need to be committed for 12 months to make this work. But it's nice though, it's, you get all the gym, every facility, you can use any facility you'd like, they're all wonderful. They all have their benefits and ambiance. Like you said, the Fall River one was just open, it's beautiful. Dartmouth is really nice and cozy in there if you like the spa look. New Bedford's nice, it's got that old building feel, and Wareham's, that place is beautiful too. I don't know if anybody been to all of them, or? You remember the New
Yes,
Bedford one?
yes.
Yeah, I met you after my class, you were coming in for the next one,
Yeah.
so that's good. So I don't want to take up more of your time, but if there's any more questions or if I left anything out.
No, I think we're good.
Yeah.
And I'm just going to send it out to the group. There's a lot more employers that obviously couldn't make today's meeting, and I think it's important for them to know that this program is out there.
Yeah,
But it's like
thank
you
you.
said, it's definitely a commitment because it is
Mhm.
a year-long class. But it's really great that we offer this in our community. so.
Yeah. Well, it's a year long, 16 weeks is more condensed once a week, but once a month just to check in is almost like you need that. You're not just like 16 weeks and you cut the tie, you have that once a month.
Now the
commitment.
nutrition is so important, and I
Mhm.
noticed that you do the reading nutrition labels. Do you guys do the grocery store visits and stuff like that?
We have it, it's not in the curriculum, we
Okay.
don't do that, but it might be something we could offer, as that would go right by the curriculum of the book.
Yeah. That,
If somebody already belongs to the Y, is there a charge?
Yeah, there is, the program is, you have to pay the program.
but they freeze the membership.
Yeah, because most members have that monthly withdrawal from their checking account, so what we do is freeze that,
Yeah.
and then you pay for the program, and then once the program's done, then you go back to the withdrawal, so.
Which it's
Yeah.
only, I figured it out, it's
Mhm.
$35 a month.
Yeah,
And so that's actually cheaper than my membership because I pay $45 a month for an individual.
it is,
So I mean, if you're
Mhm.
like
looking to join something.
Yeah, I
Yeah.
think it's reasonable, but I also feel like if you have, like, say you have a family membership, I guess, I'm assuming they would just freeze the membership and then you would just pay,
The difference.
yeah.
Yeah, you do. I was gonna say with that, 429, we're talking about something there.
I'm sure that if you have a family, and let's just say there's 2 of you going, I would assume you'd have to change the other person to a single. Because that single, your husband's still gonna have to pay,
Right.
but you would stop the family membership and just do this. I would guess that.
Yeah, we'd have to work that out, right. I mean, the best way, the cheapest for everybody involved would be great. But if you were looking to join a gym and you wanted this program, you're gonna save a ton of money.
Right.
You don't have to pay a registration fee if you're gonna join the Y. There's a 70, or any gym, there's usually a registration fee. That's not part of the 429. So you really save, if you're gonna join as an individual adult, new member, or the program, if this is something that you qualified for, you're saving about $185 with the registration fee and the cost. All right.
Thank you, Dara.
Thank you.
I'm sorry, can I ask one more question? Did
Yeah.
you say that, is there a registered dietitian that works this program?
No, they're lifestyle coaches. We
Okay.
facilitate the program.
Okay.
It's all
Yeah.
the evidence. I should have brought it's a whole
I'm just
binder.
asking for, again,
No.
for insurance purposes.
No, it's
that's
true.
all.
It's not a
So,
registered
okay.
dietitian, but it's all, we journal, they journal their activity to keep them on track, because journaling your food and your activity is huge. Evidence shows that by journaling your food intake and your activity level, it's key to really staying on track. So we really, that's done every week. We have to even account for that on our data collection, that, yep, they did their journaling and stuff like that. So it's, but it's all evidence-based program. It's you gotta go with the fight. You gotta go right by the book. Basically, you add your own flair to it, but make it fun. It's not like, it's a fun group. The Y has sent like 30,000 people through it. They've been offering it for a few years already, but not here.
Yeah.
Like Rhode Island itself has been offering it for 4 years, and I've
Yeah.
talked to them, and they said that some fabulous results. People are just loving it because they feel better. They met friends, and now they're a part of the Y. They're part of like working out and activity is a part of their life now because that 1 year.
So yeah, and so I wonder, there's no other program out there. So like, say you are at your doctor's office and you are at risk for this. What do they tell you to do?
They send you to usually a dietitian at the
Right.
hospital for one.
And that's it, for
Right.
one visit. There's no support. So
Yeah.
that's why this is so valuable, but more importantly, how do we grab that population? So, I mean, I would go as far as meeting with the physicians, going to South Coast, going to St. Anne's, and like letting these doctors know, like if you have a pre-diabetic patient, this is your referral.
Exactly.
And it's in a community setting that is universal, so there's no, it's not like you're going to this top gym in the area where everybody wears tight spandex.
Yeah.
You know what I mean? Like it's a
Yeah.
neutral
So
location.
that OptiFast program, do they screen, do you know if South Coast refers their patients
That's
for
a great
that
question.
for diabetes or only for obesity?
Chris?
I think it would probably depend on what the results
I'm
are.
just asking because I
Yeah.
didn't know if it would be like
For the lipid
conflict for them,
panel.
but usually
Well,
you need to offer
yeah, right?
multiple choices to people.
Yeah, I mean, we have a diabetes prevention program that we're offering as a pilot for our employees that are on the health plan.
Yeah.
Oh.
So
okay.
we do include a lipid panel in that. Obviously we have a data warehouse to draw from too. So it's more, specific to employees at this point. But, obviously with that we'll probably be expanding anyway.
I mean, that's the key to get referrals.
Yeah, that's the way to do it.
They're so busy, it's hard to get in the door and just we need
Yeah.
that 10 minutes. But I know Lou Brito, the program director at the
Awesome.
Wareham Y, right? He just, excuse me?
I said he's awesome.
Yeah, he is, a nice guy. So he just met with, he's been meeting with the primaries, and I'm just
Awesome.
ready to roll with that too, because that's key. We actually have a little doctor's prescription pad that they can write, and it's got all the Y information on it, and then they can just write it as a prescription, and then they can give us a call. Like,
I see Dr. Rocha doing something like that.
Yeah, so I met him
Yeah.
recently, so.
Yeah, so he's great,
Yeah.
and we'll have this information for our work sites at the conference. I think that's really an important piece. I think it's just a very teachable moments. We have to be able to have this information available for people that don't know that it exists.
Right.
And then, worry about the cost after and let them know
Mhm.
that it's not gonna be a barrier for them. Because I think the cost, everybody looks at the number and they're like, how am I gonna be able to afford that? Especially our lower income population where, they may be potentially more at
Mhm.
risk. So I think that's important to be able to let them know, kind of meet them where they're at.
Yeah, we do. I have some financial aid apps in there too.
Great.
But-
There are some employers do discount programs also. I know that we had someone here from the Y.
Yeah.
I was like so excited that we were gonna get it, and they haven't made that decision yet.
Oh, worksite, what did,
So the employer pays
The fitness
Yeah.
reimbursement.
the employer
Oh.
pays a portion of the
Mhm.
cost
That's
for
nice, yeah.
employees.
Usually it's like 150, I mean, that seems to be the
Yeah.
typical amount.
so it's not through insurance, or the employer's like.
It's-
Yeah,
yeah.
it's, and I
Yeah.
can't think there's who the
Yeah.
person is who came in from the Y. But I know that she met with our CEO, and I thought we were gonna, because we have something right now with South Coast. Now, is that owned by South Coast, the health trucks?
No.
Oh, okay.
Oh, I thought-
But your name is on the building, or is that?
Yeah, it's, yeah.
Was it ever owned by Southfield? It's not.
I think maybe half of it was, I'm
Yeah.
not
There was a
exactly
connection
sure.
there for
I
a
think
while.
Yeah,
because
there
of
was.
the PT aspect of it, I think
Yeah.
there was this level of
Like the
PT
cardiac,
there.
the,
Cardiac rehab.
Yeah.
Yeah.
that-
There's probably a
okay.
correlation there.
So I know that we, like, and it's very, does any employer here do,
We do.
you do.
They have a reduced rate, like a corporate rate over
Yeah,
there.
yeah.
For
Like
health
the-
tracks,
Yes,
do you offer it for the Y or just health tracks?
just health tracks, but that was done like 15 years
Yeah,
ago, maybe
so that's what
before
we
they
have
even,
health tracks
you know.
too, and I thought we were gonna switch to the Y, but then I think somebody important joined health tracks.
Oh.
That's what happens, the way the
Yeah.
decisions happen
Yeah.
in small
We
companies.
have like 10% off or something for
Yeah, that's what we do.
employers.
Yeah.
That, this is just an application just to, if you want
Great.
financial aid.
No,
so-
that's important, thank you so much.
And I have
Just-
posters, I can give you anything you'd like.